that. Is it comfortable for you to talk right now?
Yeah, doctor, I can manage.
All right. So can you please tell me more about this chest pain?
What you want to know, doctor?
Well, James, tell me, how did it started?
Actually, doctor, uh, I, I am fond of hiking. So when I am trying to go upstairs or when I'm trying to go for a hike, at that time I feel that pain, but uh, it gets better in few minutes. So I was not very concerned about it. But yesterday I was going for a walk with my wife, and suddenly I had this chest pain again. But that time, this pain lasted for, I think, 15 minutes. So my wife forced me
Oh,
to see the doctor now.
well, I can see that your wife is really concerned for you. That's a very good thing, I must say, that you came for the checkup. So, please tell me, is it all there? You told me that it's not all the time there. So, what type of pain is it? Is it sharp pain, dull pain? How can you explain that?
It's it's like something heavy is on my chest.
All right, all right. Okay, anything that makes this pain better?
Yeah, when I'm resting for a few minutes, then this pain gets better.
All right. And does this pain go anywhere else?
No, doctor.
Mm-hmm. Can you please tell me exactly where do you have this pain by pointing on the
Yeah,
chest part you
I'm
have?
having this pain here on the left side of my chest.
All right, all right. Can you please score this pain from 1 to 10, where 1 is absolutely no pain and 10 is the worst pain you have ever experienced? What
I
is
would
the score
say
of this pain?
5 or 6.
All right, all right. Anything else?
Um, no,
Okay, any breathlessness?
no.
Any feeling of sickness?
Sometimes when I'm having this pain, I feel sick for a couple of minutes as well.
Okay, okay. And any heart racing?
Yeah. Now you are asking me. Yeah, sometime I'm having heart racing.
Mm-hmm. Okay. James, when there's a chest pain, there are some particular questions we ask to know better what type of pain is it, what could be the possible reason. So please answer my questions in yes or no, okay?
Okay.
So please tell me, any fever or flu-like symptoms?
No, doctor.
Any cough?
No,
Okay, by any chance, have you hurt yourself?
no,
All right. Have you felt that this pain relief on bending forward?
no, not at all.
All right. Pain anywhere else, for example, in your calves or anywhere else?
No,
All right. James, do you have any diagnosed medical condition?
no, doctor. I'm perfectly fine. That's why I have never been to doctor for quite a long time because I'm fine.
All right, all right. So no medications for anything because you were absolutely fine for a long
Yeah,
time.
yeah,
Am I right?
yeah.
Okay, all right. So James, tell me, I would like to ask a few questions regarding your lifestyle habits as they're important for my assessment. So do you smoke?
Yeah, I smoke a couple of cigarettes per day.
All right. And what about alcohol?
No, I'm not. I don't drink, doctor.
Okay, that's great. And what about your diet? Is it well balanced?
Yeah, I eat whatever my wife cooks for me.
Okay. Well, James, you told me that you are very fond of hiking. So any other physical activity you are into regularly?
Well, I try to have a walk regularly, for at
Mhm.
least 1 hour, but because
Okay.
I'm having this pain these days, so I'm not that much active.
Okay. All right. May I know what do you do for a living?
I'm retired
All right. And with whom do you live?
with my wife.
Okay, all right. Before moving on, James, any concern you want to, me to discuss with you during this consultation?
No, doctor. I'm just concerned what kind of pain I'm having.
Okay. Thank you so much, James, for answering my questions patiently. Now, I would like to examine you with your permission in the presence of chaperone to ensure your safety. And I will also examine your chest, your heart, and general
Okay.
examination from head to toe. Okay.
Okay. So the finding is
And I
blood
will also
pressure
like
is
to run some initial blood tests, including your full blood count.
okay. So finding is blood pressure is 160 by 100. ECG is normal, and investigations are awaited.
Okay, blood pressure is 160 by 100 and ECG is normal. All right, James, from the little chit chat we have, what I examined you, it seems that you are having a high blood pressure right now. Have
Okay,
you ever
doctor.
before?
Hello, Saima, I cannot hear you.
So have you ever before have any episode?
No, doctor, I told you I'm perfectly fine.
Mm-hmm. Okay. James, the thing is that right now your blood pressure is really high, and you have told me that you have chest pain on and off. Uh, from my assessment, it seems that you might have some problem related to your heart, and your raised blood pressure could be another thing we have to look into. Okay.
Mm-hmm. Okay, doctor.
So So right now we are not sure. So I have to keep admit you in the hospital for a while, and we will monitor you
You
and
will
check
admit me
your.
here, doctor?
No, I will refer you to the A&E
But doctor, I don't
for
want to
the
go to
rest.
hospital.
Okay. Is there any particular reason you don't want to go hospital?
Yeah, because I don't like hospital, doctor. My father died in hospital, and since then I hate hospital. I don't want to go there.
Well, James, I can understand that you are really worried. I am my deepest condolences for your father. But the thing is, right now your blood pressure is really high, and there's a possibility that you might have this chest pain might be because of a condition called angina. So you need some assessment at the hospital and management of your blood pressure. It's
But doctor,
important
you
for your
can
health.
give me whatever medications you want here, but I don't want to go to hospital. Okay, time's up.
All right. Hello.
Hello.
Myself, Dr. Sam Mukhtabar, one of the junior doctors here in the department, A&E. Can you please confirm your name and age?
Yeah, doctor, my name is Olivia and I'm 28.
Nice meeting you, Olivia. So how can I help you today?
Well, doctor, I'm having this chest pain and I'm having some problem with my breathing.
Oh, I'm so sorry to hear that. Is it comfortable for you to talk right now?
Yeah, doctor, I can manage.
Okay, all right. So please tell me more about your chest pain.
Well, doctor, for past 8 hours, I'm having this chest pain and
Mhm.
it is getting worse, doctor.
Okay, it seems that you are feeling very much. It's really painful for you. So please tell me, what were you doing 8 hours back when this started?
I was doing nothing, doctor. Nothing
Okay,
specific.
okay. Did it sudden all? It was sudden in onset, or it started gradually?
Yeah, it started all of a sudden, doctor.
Uh-huh. And is it continuously there, or it comes and goes?
Yeah, it's been there all the time, doctor.
All right. And does it go anywhere else in the body?
No, it's not going anywhere.
Mm-hmm. Olivia, is it getting worse?
Yeah, I told you, doctor, it's getting worse.
Okay, all right. Anything that makes it worse?
Yeah, when I am coughing or I am trying to take a deep breath, it's getting worse, doctor.
All right. And by any chance, anything that makes it better?
No, nothing.
Mm-hmm. Can you score this pain from 1 to 10, where 1 is no pain and 10 is the worst pain you have ever experienced?
It is 7, doctor.
All right. You told me that you are also having the breathing difficulty. Since when are you having it?
Yeah, same time when my pain started, I'm having this.
All right. Is it getting worse also?
Yeah,
And anything that makes it worse?
I'm not aware of anything.
Mhm. All right. So, by any chance, anything else?
No,
All right. Any sick, nausea or vomiting?
no,
Any heart racing?
no.
All right. Well, I have to ask you a few specific questions. So please answer them in yes or no. That would be important for my assessment. Okay.
Okay.
Do you have any fever or flu-like symptoms recently?
No,
Any cough?
no,
All right. Any heartburn?
no.
All right. Any calf pain?
Oh yeah, doctor. I'm having some pain in my leg as well.
Okay. All right. And can you please tell me more about it?
Um, Actually, I was having this pain for a couple of days. I don't know if it
Mhm.
is relevant to this or not, but yeah, it was there.
Okay, Olivia, thank you so much for sharing the information. So, do you have any recent history of travel?
No?
All right. Had you taken anything for this cough pain? Any medication?
Yeah, I was trying paracetamol and I think it was helping it.
All right. All right. Any diagnosed medical condition, Olivia?
No?
Okay. Any medications you are on apart from the paracetamol you use for pain?
No?
Any known allergies?
No, doctor, but I'm not on any medication like prescribed medication. But
Okay.
I'm under transition from I
Uh-huh.
want to be a female, so I'm taking some over the counter hormones.
All right. So, how are you taking it? Can you tell me more about it?
Yeah, I am taking injections.
Okay, so can you please tell me the names of those injections? Are you aware of the names and how are you taking it? I mean, the dosages?
Well, I don't know the doses, but it is. Uh, I somebody told me that they are the hormones which can help me to be a female. So I'm not sure
Okay,
what's the name.
okay, all right. So, thank, okay, please, thank you so much, Olivia, for sharing all this information with me. Just a few more questions regarding your lifestyle, and then we will get back to this point later. So, please tell me, do you smoke?
No, doctor.
And what about alcohol?
No.
Okay. A few, please don't take me wrong, but a few questions regarding your sexual history. Are you sexually active?
No, doctor, not now.
All right. Okay. So, apart from that, anything else you want to tell me?
No, doctor.
Hmm. Do you have any idea what it could be? This chest pain, shortness of breath?
Is it heart attack, doctor?
Well, I have to examine you first, and then I will be able to answer your questions. Okay.
Mm-hmm.
So thank you so much for answering my questions so far. I would like to examine you from head to toe with your permission and during the in the presence of chaperone. I will also examine your vitals, your heart rate, respiratory rate, oxygen saturation, and blood pressure. I will also examine your chest. Is that
Okay.
okay?
Oxygen saturation
And
is, yes, SpO2 is 88. Blood pressure is 90/70. Heart rate
Mhm.
and respiratory rate are high.
Okay. Okay. Olivia, from the literature chat we have and the examination, it seems that you might have a condition called pulmonary embolism. Have you heard about it?
No, doctor, what is that?
Well, it is a condition when you have blood clot in your lungs, and because of that, right now your oxygen saturation is low. So, and you're having chest pain. So promptly we have to start giving you certain medications. First of all, I will give you oxygen and painkillers and anti-sickness medications also. Okay.
Okay, doctor, is it serious?
Well, it's a good thing that you are in the hospital and you are under treatment, but otherwise, it could be life threatening. I should tell you the truth. But the next thing we are going to do about it is we are going to give you some blood thinner medication in the form of injections and run initial tests and a specific test called CTPA immediately. And then we will be in a better position to confirm the diagnosis and talk about further management plan.
Okay, doctor, but after that, can I go home?
May I know, is there any particular reason you want to go home, Olivia?
Yeah, just like I don't want to stay in hospitals.
Mm-hmm. Well, Olivia, the thing is that it's a good thing that it is you are here in the hospital and we are able to diagnose you. But if the test you have to wait till the test results. If the test results confirms the diagnosis that you are having pulmonary embolism, in that case you might have to stay in the hospital for a while for treatment. Okay.
Okay, start. I'm starting the timer.
Hello.
Hello, doctor.
Myself, Dr. Sam Bakhtawar, one of the junior doctors here in the department. Can you please confirm your name and age?
Yeah, doctor, my name is Stephen and I'm 55.
All right, Stephen, nice meeting you. So I can see from my notes that you are here for your first review, am I right?
Yeah, doctor, correct. Uh, they told me to come back after 2 weeks, so I'm here.
All right. So you have recently been diagnosed as a hypertensive patient, and you were admitted for some condition also. Can you please tell me more about it?
Yeah, actually, doctor, I was having an insect bite in my leg. So they told me it led to some infection. So they admitted me here. They gave me antibiotics, and then they told me that I'm having high blood pressure and I should be on medication.
Okay. All right. All right. So, and are you aware of the medications you are on?
Yeah, doctor, I am taking blood pressure medications like it is called, I think, amlodipine,
Okay. All right.
and another medication to control my cholesterol level and a
Okay.
blood thinner.
Okay, that's great. Well, any other diagnosed medical condition apart from recently diagnosed hypertension?
No,
All right. And any medications you are on apart from these medications recently started?
Oh yeah, doctor, I'm on insulin as well.
Okay. Okay. Thank you so much, Stephen, for sharing the information. Can you please tell me more about it? How are you taking it?
I'm taking injections.
Okay. All right. Right then. And is your diabetes well controlled?
Yeah, I think I am checking my blood sugar level at home and it is controlled.
All right. That's great. So, any complications because of it, like foot problems or any pain, anything else?
No.
All right, all right. Well, coming back to your blood pressure, so you are on certain medications. Are you taking them regularly?
Yes, doctor. I was taking them regularly, but 1 week back, I
Mhm.
noticed that I'm having some swelling in my leg, and because of that, uh, I like somebody told me it might be because of the medication, so I stopped them.
Okay, so which medication have you stopped?
The blood pressure medication, amlodipine, doctor.
All right. So you are taking the other two regularly, am I right?
Yeah, I was taking those medication for quite a long time, but right now, because of this blood pressure medication, I think I was having that swelling.
Mm-hmm. Okay, all right. So, well, your concern is really valid. We will look into but before that, please tell me, by any chance, did you hurt your leg?
No, no.
Is it the same leg you have the insect bite and cellulitis?
Yes, doctor.
Okay.
It actually, the
So,
swelling is in my both legs.
okay. All right. All right. Uh, okay. So, anything else apart from that that is bothering you?
No.
All right. All right. So, we can look into that. I have to ask you a few quick questions regarding your lifestyle, and then I will address this problem. Okay.
Okay.
So, please tell me, do you smoke?
Yes, doctor. I'm smoking 1 pack a day.
Okay. All right. And what about alcohol?
No, I don't drink.
Mm-hmm. And thank you so much for sharing the information. What about your diet? Is it well balanced?
Yeah, I think so.
Mm-hmm. And what about the physical exercise? Are you physically active nowadays?
No, doctor. At my age, people are
Mm-hmm.
not very much active.
Mm-hmm. All right, all right. Uh, any other problem like heart racing or any chest pain right now?
No,
Okay. Any breathlessness or nausea,
no,
vomiting?
no, no, doctor.
All right. Well, okay, that's great. Thank you, Stefan, for answering my questions so far. Um, I would, with your permission and ensuring your privacy by the presence of chaperone, I would like to examine you. I will check your blood pressure, respiratory rate, heart rate, oxygen saturation, and I will examine your chest and examine you from head to toe in general. Okay.
Okay, so
And
blood pressure is blood
I
pressure
will
is
also do some
160 by 100.
Okay. I will also do some initial investigations like full blood count, urea electrolyte, PSR, and ECG.
Okay,
No findings?
no.
Okay. Uh, Thank you so much, Stefan, for answering my questions so far. Uh, from the little chit chat we had, and after examining you, it seems that right now your blood pressure is high. It's 160 by 100. So you just told me that you are having some swelling in your legs and you have stopped the medication. So the thing is that you are having the blood pressure problem right now. For that, you need treatment.
Mm-hmm. Okay.
So I will inform my seniors regarding the problem you just noticed, this leg swelling, and they will review your medications. Okay, and but right now your blood pressure is really high. We will give you some medications to control this blood pressure right now, and if it's not well controlled, we will send you to the A&E, and once you are stable, uh, we will review your medications, and there are certain lifestyle modifications you also have to keep into consideration. Does this look like a plan to you?
Okay, doctor. But will this medicine be giving me some side effect as well?
Well, yes, there could be some side effects. As right now you are on amlodipine, this is I'm sorry, I'm not sure that which from which group it is, but we will change you on a drug that is from the group AC inhibitor. It has some side effects. If you have any problem, it might affect your kidney. Um, I'm so sorry, I just forgot.
Okay, it's okay. Next patient.
Okay,
You ready?
yes. Hello,
Hello.
myself, Dr. Sama Bakhtavar, one of the junior doctors here in the department. Can you please confirm your name and age?
Yes, doctor. My name is Alison and I am 55.
All right, Alison, nice meeting you. So I can see from my notes that you are here for your follow-up, am I right?
Yeah, doctor.
Yes, and you had shingles 3 months back.
Yeah, you are right, doctor.
Okay, so how are you feeling now? Everything okay?
No, doctor. I'm still having that chest pain and it is bothering me a lot these days, doctor.
Okay, so apart from chest pain, since when are you having this chest pain?
I'm having this chest pain for 3 months now.
All
Um,
right.
but doctors told me it will go away, but still I'm having this chest pain.
All right. So is it the same it used to be, or has it
Yes.
changed?
Yeah, doctor, it is same, and sometimes I feel it's getting worse as well.
Okay. Anything that makes it worse?
I don't know, doctor. Sometimes the heat is bothering me, like at that time when I'm feeling hot, then the pain is more. Sometime when I'm taking bath, at that time the pain gets more. I don't know, doctor, what's happening.
Okay. All right. So anything that has made this pain better?
You have given me some patches to put on put on my chest, and I think those are helping.
Okay.
Like sometimes those are helping, and sometimes they are not helping at all.
Okay. Okay. Well, regarding this chest pain, I would like to clarify one thing. That is it at the same place where you had the rash?
Yes, doctor. It is almost at the same place.
And does this pain go anywhere else in your body?
No,
Okay. All right. Anything else apart from this chest pain?
no,
All right. Any breathlessness or any heart racing?
no,
All right. Any feeling of sickness?
no.
All right. Well, when it comes to chest pain, there are certain specific questions we might have to ask. So please answer them in yes or no if they are relevant. Okay.
Okay.
So please tell me any fever or flu-like symptoms recently?
No, doctor.
Any cough?
No.
All right. And any pain anywhere else in your body?
No, doctor.
All right. Any history of travel?
No.
So, uh, before this episode of shingles, have you ever had chicken pox?
Yeah, when I was a kid, I had chicken pox.
All right, all right. So, any other diagnosed medical condition?
No.
Any medications you are on?
No.
All right. You told that you had used some patch for this pain relief. Any other pain medication other than that you used for this pain?
Yeah, they have given me ibuprofen. They have given me paracetamol. I'm using them as well.
Okay, okay, that's and they are not relieving your pain at all. Uh-huh.
No, doctor.
Oh dear, so sorry to hear that. Any known medication allergies or food allergies?
No.
Any family history of any medical condition?
No.
All right. Any history of any shingle jabs?
No.
All right. Well, Ellison, I have to ask you a few quick questions regarding your lifestyle habits, as these are also important for my assessment. So please tell me, do you smoke?
No, doctor. I don't smoke.
Okay. And what about alcohol?
No.
Okay. Is your diet well balanced?
Yes.
Okay. And tell me about the physical exercise routine.
No, I'm not very active, doctor.
Hmm. Well, Alison, sometimes when you have such a pain that is, for such a long time, it's quite overwhelming for some people. Is it bothersome for you too?
Yeah, doctor, I told you it's getting worse and it's not going away by anything. So
Okay.
I don't know how to cope up with that.
Okay. And so it is affecting you and your life. Uh, it seems that.
Yeah,
Mm-hmm.
yeah, correct.
Okay. So may I know what do you do for living?
I am working in an office.
And with whom do you live?
I live alone.
All right. Well, thank you so much for answering my questions patiently. Now, with your permission and ensuring privacy and the presence of chaperone, I will examine you and I will examine your heart rate, respiratory rate, oxygen saturation, and blood pressure, and examine your chest and, in general, head to toe examination also. Is that okay?
Mm-hmm.
And I will also like to do some initial investigations like full blood count, urine electrolyte, BSR, and your ECG and chest X-ray. All right.
Okay.
Okay. So, any findings?
No.
All right, Ellison. So, what you have told me so far, and from my examination, it seems that you are having a condition called post-herpetic neuralgia. Have you heard about it?
Yeah, I think they told me in my last visit that I can have this kind of thing.
Hmm. Hmm. Well, actually, it is a type of pain that occurs after after an episode of shingles, particularly at the site of rash. So it seems that it might be in your case.
Mm-hmm. Okay.
Okay, so what you have told me and what can I see from your notes that you were given a lot of different pain medications and other pain or management options, but they're not working for you that way. So my treatment right now, I will refer you to the pain specialist, and he will, decide a proper management plan to relieve your pain. All right.
Yeah, okay, doctor.
Okay, and the thing is that sometimes there are certain medications apart from the conventional painkillers that are seen to be effective, as this pain is basically a nerve. We can call it in easy terms, it's a nerve pain. Though there are certain medications that are used to control depression, they are seen to be effective in nerve pain management also. That might have.
Okay.
So it's a telephonic conversation, right?
Yeah, telephonic.
Okay. Hello.
Hello.
Myself, Dr. Sama Bukhtawer speaking from the GP.
Yes, doctor. I have been calling you to discuss something very important.
Okay. Well, before we start discussion, there are